A new study published in the journal Neurology has found that taking high doses of this one vitamin may raise your risk of stroke by up to 200%. But wait, before you throw away all your vitamins, let me share more details about this new study so you don't become unnecessarily alarmed. In today's video, I'm going to answer the following questions. What vitamin is this? How much is too much? Is it better to space out your doses or take them all at once? Which patients are most at risk? And finally, what should you do next? So if you're ready, let's get into it. I'm a board-certified diagnostic and interventional Those are also touted to be rich in vitamin E. Are those included in this study's findings? Not really. That asked because the vitamin E found in these oils is on the same type as the one found in supplements. If you're taking vitamin E from food, then it doesn't matter. Now, this study specifically looked at people older than 75 years old, but I think it is reasonable to assume that the risks apply to anyone above 75 who takes high doses of vitamin E. You might be surprised to learn that some of your over-the-counter medications contain high levels of vitamin E, so make sure you read the labels. Vitamin E is a great example of how something that is good for you in small doses can become harmful in large doses. So remember, everything in life is about balance and moderation. Next, if you decide to continue taking vitamin E, I would recommend splitting your doses throughout the day instead of taking them all at once. Let me know what you think in the comments section below. Do you take vitamin E? Will you continue taking it after watching this video? Or maybe you're already avoiding it? And if you did enjoy this video, please give it a thumbs up and consider sharing it with someone else who might benefit. As always, you can find the studies referenced in this video in the description below. Thank you so much for watching and stay healthy, my friends. And lastly, focus on eating healthy foods that naturally contain vitamin E, such as sunflower seeds, almonds, and spinach. Just eat your food throughout the day and you're good to go. But if you're taking vitamin E from supplements, then it's best to check with your doctor or pharmacist about how to take them. The main form of vitamin E in these oils is called and although tocopherols are also a type of vitamin E, they're not considered pro-vitamin E, and they're not technically included in the recommended daily allowance. Now studies have shown that tocopherols are still good for you, but because they're not the same as the vitamin E used in the study, I would unworry too much about this study as findings. If you get in your vitamin E mainly from food, and if you like what you see here, make sure you subscribe so you can be notified when I post new videos. If you're under 75, then higher doses of vitamin E might actually be good for you. But if you're over 75, then I would recommend keeping your daily intake below 400 IU per day. And this goes for all forms of vitamin E, whether you're getting it from supplements or from food. The participants were divided into 4 groups based on their daily intake of vitamin E. Group I took 200 IU of vitamin E per day. Now you might be thinking, well, I don't take vitamin E, I don't take that much vitamin E, I only take a multivitamin. Well, vitamin E is commonly found in many over-the-counter supplements, including multivitamins. In fact, the recommended daily allowance for adults is 15 milligrams. But what does 15 milligrams of vitamin E look like? Well, this is where things can get confusing, because vitamin E actually comes in different forms, which have different potencies. Now, there are 8 different forms of vitamin E, but the most common form that you'll find in supplements is called alpha-tocopherol. And interestingly, it's the only form that's included in the recommended dietary allowance. Now there are several different types of alpha, but the most common one that you'll find in supplements is called D-alpha-tocopherol, and this is the form of vitamin E that was used in this study. Now if you look at the labels of your supplements, you'll notice that some list D-alpha-tocopherols and others list simply alpha-tocopherol, and this is because D-alpha-tocopherols is actually a subgroup within the larger group of alpha-tocopherols. So D-alpha-tocopherols is a more specific and technically correct way of referring to the type of vitamin E most commonly found in supplements. Now, I know this can be really confusing, so let me summarize it for you. Alpha-tocopherol is the most common form of vitamin E found in supplements. D-alpha-tocopherol is the most common type of alpha-tocopherol found in supplements and the form of vitamin E that was studied. Group 2 took 400 IU per day. Group 3 took 800 IU per day, and Group 4 took 1200 IU per day. All participants received their daily dose for 2 years. Now that's a long time, so just keep that in mind when you hear the results. And they concluded that those who took higher doses of vitamin E had an increased risk of stroke. Specifically, people who took 1200 IU of vitamin E per day had a 24% higher risk of stroke compared to those who took none. And those who took 400 to 800 IU per day had a 17% higher risk. However, this was only true for people over 75 years old. In fact, for those between 65 and 75 years old, higher doses of vitamin E actually lowered the risk of stroke. Go figure. This study was conducted by researchers at the American Academy of Neurology, and it looked at over 46,000 people aged 65 and older who had no history of stroke or cardiovascular disease. So let's review what we learned from this study. First, which vitamin is this? It's vitamin E. Now what about vitamin E oils, like sunflower oil or olive oil? Next, how much is too much? Well, The answer depends on your age. You might be wondering, is it better to space out my doses or take them all at once? Well, the answer is, it depends. Next, which patients are most at risk? Anyone over the age of 75 taking more than 400 IU of vitamin E per day. And finally, what should you do next? Well, the first step is to review your current supplements and medications with a doctor or a pharmacist. At the end of the day, the most important thing is to be informed and make smart decisions about the supplements that you take. Alright everyone, that's been a quick review of this new study on vitamin E.